Ever wondered what to do when you have a nosebleed? A rather common occurrence, nosebleeds, or as the medical world calls it, epistaxis, can catch us off guard at the most inconvenient times. What triggers these sudden, often alarming nosebleeds, you ask? Well, several factors can set off this unwelcome guest. Seasonal changes, for instance, can have a profound impact on your nasal health. Dryness, too, is a big culprit, causing the delicate lining of your nose to become irritated and bleed. Unintentional scratches, certain medications, and injuries can also lead to nosebleeds. And if you're on blood thinners, you might find your nosebleeds to be a tad more severe than others. But here's the silver lining. Most nosebleeds are not a serious medical problem. They might be a bit bothersome, sure, but they're rarely a cause for alarm. So, what do you do when you have a nosebleed? First things first, don't panic. It's time to take action. When a nosebleed strikes, the initial reaction might be one of alarm, but remember, most nosebleeds are not a serious medical concern. They can be a bit bothersome, yes, but they're usually easy to manage. So, what's the first step? Pinch your nose shut. Yes, you heard it right, pinch your nose shut. This simple action puts pressure on the bleeding point in the nasal septum, helping the blood to clot and thus stop the bleeding. Now this isn't a quick fix. You should plan to keep your nose pinched for about 10 to 15 minutes. While you're doing this, it's important to stay calm. Stress or panic can increase your blood pressure, which can, in turn, make the nosebleed worse. Try to breathe normally through your mouth and avoid any strenuous activity. Now, you might be tempted to lay down or tilt your head back during this time, but resist that urge. Lying down can actually cause the blood to flow down your throat, which might lead to coughing or choking. Instead, sit up straight or lean slightly forward. This will help the blood to drain out from your nose, preventing any possible complications. Remember, the goal here is to encourage the blood to clot, which is the body's natural way of stopping bleeding. By pinching your nose and sitting upright, you're helping this process along. If the bleeding doesn't stop, it's time to move on to the next step. But remember, don't panic. Nosebleeds, while inconvenient, are generally not something to be overly concerned about. Just stay calm, follow these steps, and you'll be able to handle it like a pro. Still bleeding? Don't worry, we've got you covered. If the first attempt at stopping the nosebleed didn't quite do the trick, don't panic. There are additional steps you can take. The first thing you should do is to try the method we discussed earlier one more time. That's right, pinch your nostrils shut again. This time, however, try to hold it for a little bit longer, up to 15 minutes. Remember to breathe through your mouth and stay calm. It's important to note that while this may seem like a long time, patience is key when dealing with nosebleeds. While you're waiting, try to keep your head at a level higher than your heart. This can help reduce the flow of blood. Also, don't tilt your head back. Contrary to common belief, this can actually make things worse, allowing the blood to flow down your throat. Now, what if the bleeding still doesn't stop after this second attempt? This is when it may be necessary to seek emergency medical care. Persistent nosebleeds can sometimes be a sign of more serious health issues, or they may simply require medical intervention to stop the bleeding. Let's be clear on this. If your nosebleed persists for more than 20 minutes, or if it's accompanied by symptoms like dizziness, weakness, or fainting, it's time to go to the emergency room. Also, if you're on blood thinners or if the nosebleed started due to a head injury, don't waste time trying to handle it on your own. Seek medical help immediately. And finally, for those of you who frequently suffer from nosebleeds, consider using a humidifier in your home. This can help to moisten your nasal membranes and prevent nosebleeds caused by dryness. Remember, if the bleeding persists, don't hesitate to seek medical help. Now that we've covered how to handle a nosebleed, let's talk about how to prevent them. Preventing nosebleeds is often a matter of careful attention to your environment and habits. One of the most common causes of nosebleeds is dryness, whether due to artificial heating in winter or air conditioning in summer. The solution? Consider using a humidifier. By adding moisture to the air, a humidifier can help keep your nasal passages hydrated and less prone to bleeding. Another common culprit in causing nosebleeds is the seemingly innocent habit of nose picking or scratching. It's essential to avoid these actions as they can irritate or damage the delicate blood vessels inside your nose, leading to a nosebleed. If you find your nose itchy or uncomfortable, rather than scratching or picking, try a saline nasal spray to soothe and moisturize your nasal passages. Medications are another factor to consider. Certain medications, particularly blood thinners, can increase your risk of nosebleeds. If you're on such medications, it's crucial to be extra cautious. That doesn't mean you need to stop taking your prescribed medication, but it does highlight the importance of handling your nose with care. Seasonal changes can also bring about nosebleeds. As we transition from one season to another, our bodies need to adjust. This can sometimes lead to drier nasal passages and, you guessed it, nosebleeds. So, as the seasons change, be mindful of the potential impact on your nose and take appropriate steps to keep it moisturized. Lastly, if you're prone to nosebleeds, it might be worthwhile to have regular checkups with your doctor to monitor your situation and get personalized advice. Armed with these tips, you're now prepared to handle and prevent nosebleeds. Remember, knowledge is the best defense.